Hi, I'm Karen Henderson, and I want to welcome you to today's show where we'll be talking all things Medicare. With 14.7% of the residents in Westborough being 65 or over, and the Medicare General Enrollment Period ending actually next week on March 31st, we thought we'd do a segment on the topic with an expert who can offer a bit of guidance in what's important for our Medicare shoppers. So my guest today is Susan Flanagan, a senior plan consultant from Blue Cross Blue Shield of Massachusetts. Welcome, Susan, and thanks for joining us.
Oh, thank you so much for having me. I appreciate the opportunity. Thank you.
All right, so I want to start off by acknowledging that, like many communities, Westborough has a growing sector of folks working beyond 65. They're delaying retirement, they're deferring Social Security benefits, and that Medicare landscape can be challenging to navigate. I mean, especially with the wide variety of Medicare health plans available. So given that challenge, I'd like to start with some basics just to give us a foundation for understanding Medicare. So we'll start out with just a what is Medicare question.
Oh, great question. So what is Medicare? So Medicare is health insurance provided by the federal government. It's really broken down into two parts. There's Medicare Part A, which helps cover hospitalization and skilled nursing, which is usually premium free for most people. And then there's Medicare Part B, which is all of your doctor care, whether you're in or out of the hospital, and then all of your outpatient services, labs, x-rays, MRIs. Most people for Medicare Part B, there's a premium of $164.90 per person per month. And if they're collecting Social Security and going on to Medicare, that comes automatically out of their Social Security check. But again, you don't need to be collecting Social Security to go on to Medicare. Generally speaking, you're eligible for Medicare. Most people are eligible for Medicare at age 65, or there's certain people through select disabilities or specific medical conditions that could qualify for Medicare earlier. And I just say, like, a very oversimplification, if you want to think about Medicare in simple terms, think about it as an 80-20 plan. Medicare covers you 80%, you pay 20%, and there's some deductibles. So sometimes people think, oh, I'm going to have Medicare, it covers everything. It was never really meant to cover everything. It's there as a protection, and really think 80-20 plan. Some deductibles is what Medicare would do.
Okay. And do you have to enroll in Medicare?
You know, that's a great question. That's another one we get all the time. And I think as soon as people are approaching age 65, they start to be inundated with information, and their friends and their neighbors are saying, you have to take Medicare at age 65. And that may or may not be true, really depending on their personal situation. So if somebody's turning 65 and they're not actively working with coverage through their employer, most of the time they're going to need to take Medicare if they don't want to be penalized later on. But there are a select group of people that, you know, as you said earlier, they might be saying, well, I'm working past age 65. I'm still at my company. It's more than 20 employees. There's certain situations where you may not have to take Medicare at that point in time. And we always direct people back. If you have any questions on that, go to Social Security. They're the experts, because, you know, everybody will say you have to take it or you don't have to do this. So Social Security is really the expert on those questions.
Yeah, interesting. Because I know, like, for people who have retiree health plans, kind of what's the relationship there then with that retiree health plan and their Medicare plan?
Sure. So it's really great. So if that brings up another type of topic. Let's say you're working and then you're retiring. Before you ever retire, if you worked at a company for 10, 20 years, your first question should be, when I leave, do I have retiree coverage for my health? Because you don't want to leave anything on the table if you have that available to you. And a lot of times, like a federal employee, state employees, they may have that retiree coverage. And then to answer your question, the relationship to Medicare, Usually when you're going on to a retiree plan and you're age 65, they're going to want you to have Medicare with that retiree plan. But just like everything else in the world, there's exceptions, and some of the federal employees don't have to. But generally speaking, a retiree health plan, it's going to be Medicare is still your starting point, and then you're picking up that retiree plan. And if you're one of the lucky people that have a retiree plan, that's great. But for most people, when they're leaving that employer plan, it's really the first time they might be navigating this whole system on their own. So up until that point, they had an HR department picking a few plans. And now when they are leaving that employer, now they've learned all this new vocabulary. What's a Medicare plan? What's Medicare Advantage, Medicare Supplement? And they're going to be navigating this new Medicare landscape. So it can be overwhelming.
Right.
Yeah.
And you covered this a little bit, but just talking about what does Medicare typically cover? So you mentioned that a little bit, but let's go back and talk about that a little bit.
Sure. So Medicare typically is an 80-20 plan. So Medicare covers, if you went to the doctor, Medicare's lab, x-ray, Medicare is generally going to cover 80% of that cost, and the beneficiary would be paying 20%. And there's some deductibles too, if you go into the hospital, or in 2023 for the medical deductible, it's $226 this year. So somebody would pay the first $226 of their medical care this year. And then after that, that 80-20 kind of goes into play. So if they want more coverage than Medicare, they don't have to. They could stay with the 80-20 type plan, but many people want the more coverage. So then they look to a private insurance company like Blue Cross or other carriers to have that additional coverage in addition to Medicare. And there's typically two pathways that they can go down. There's a Medicare Advantage, which is all-in-one medical prescriptions. Those are the ones you might have extras towards dental, vision, hearing, or there's another type of option called Medicare Supplement plans, which typically just pick up where Medicare left off, and then you buy a separate prescription drug plan with those.
Huh, interesting. Now, why would you say now is an important time to be understanding Medicare? Like, is there a timing issue?
Yeah, so I would say it's always a great time to understand. The earlier you can start to educate yourself, the more when you need to make those decisions, it's going to be easier for you. But right now at this time, January 1st through March 31st is the Medicare Advantage open enrollment period. And what that would mean is if you are on a Medicare Advantage plan, an HMO or a PPO, you get this extra time period to relook at your plan and say, am I on the right plan for me? And if you are, you just continue on. But if it's a time where you say, you know what, the new year kind of came up, I never really looked at those benefit changes, maybe I need to make a change. You have this one opportunity to do this now until the end of March. And then after March, come April 1st, then if you need to make a change outside of that window, it's going to be every year during October 15th through December 7th. So right now is that change period. Get an extra look if you didn't look before the new year.
Right. And have there been any changes for this year?
So it would depend, on the health plans, whatever private plan that you pick, there's typically changes each year, and they would let you know those changes sometime before October, but they don't take place until January. So that's why you kind of get that extra thing that, I didn't look at it, now I went to my doctor, or something's different, you can change. But a nice change that happened through Medicare with the Inflation Reduction Act is this year across the board, if people are on insulin, which about 1/3 of the Medicare beneficiaries are, they will now pay no more than a $35 copayment for that insulin, which is a huge savings for a lot of people. So.
Right.
It's a
Yeah, you heard a
great,
lot about
great
that
change.
in the news. It
Yeah.
seemed like they were really good about letting people know that, and a
Yeah.
big help, like you said. There's so many people who need that.
Mhm.
So I know that this is something that I've helped my parents with before. I know a lot of people. It's not just seniors that need to understand all this, but some of the people in their world that are helping them try to navigate some of this. So, what are your tips for those folks and what they're considering in those Medicare plans?
Sure. So education of the basics first. So, if you came to Blue Cross, we have a whole list of options. You go to other carriers, they have a whole list of options. But the best place to start is always to understand first that vocabulary, the types of plans. And to do that, there's a whole bunch of different ways you can do it. You certainly can come on to our Blue Cross website. We are bluecrossma.org, and then you click on Medicare. There's a host of educational videos, information just on the basics. And then there's the product information. We have online webinars. We're out in the community doing presentations. Another avenue is Shine, serving health information needs of everyone. And they're right at the Westborough Council on Aging. They can sit down with people one-on-one, give you the education, and also very aware of all the different options and carriers out there offering the Medicare plans. Medicare.gov has information. So there's no shortage of resources, but my tip would be understand the basics first. And then when you look at the product information, it always will make a lot more sense to you.
Right. And I would say, you mentioned the Westborough Council on Aging, that there are Shine counselors available at the Westborough Senior Center every Thursday, I believe, to meet with people. I know that they're just a great resource, and you can sit down and have those discussions, talk about your own situation with them. And kind of along those lines, if you are someone who's trying to consider which Medicare plan is best for me, what are some of the things you should consider? Like considering cost, maybe considering your health, like some of the things, if I'm trying to consider which plan to go with, what are some of those things I should consider?
You've said it. So, you can consider, you don't want to just look at the cost of the plan. You really want to be thinking about your health and some of the things that are important to you. So some of the plans out there, they include dental, they include vision, hearing. Are those benefits important to you? They could be. Or, maybe something else is important to you at this point. Maybe you say, well, it's important to me. I don't want to have co-payments. That can be a different type of plan. So you want to think about yourself, cost, benefits, what you're looking for. And I always say to know that it's not a lifetime decision. We're just talking about this in this period right now. You can check and change your plan right now if it didn't fit you. But every year you kind of want to go through this process, take a moment and say, what do I need from my health plan this year? What is my health plan giving me? What is the cost? And every year people can change their plans every October 15th through December 7th for January 1st effective date as well. So
Yeah, so I love that point, because it does feel like this monumental decision, and the fact that you can make those changes yearly can help people breathe a little easier, I think. And I think reassessing where you're at health-wise each year, or again, your parents or relatives that you're helping with this, where their providers are those providers in network or not? So, as their health is changing, things that they might want to consider, and the fact that you can do that multiple times, that it's not a one and done kind of thing, is really important for people to understand.
And I would say too, take advantage, as you said, of Shine, because you can always make an appointment with Shine. And sometimes you can just tell them your situation, and they have the understanding. They can kind of say, well, maybe in this situation, a lot of people might like this type of plan. You can look here. They're never going to decide for you, but they do have the knowledge to help you kind of navigate the whole system.
Right,
So,
love that. So is there anything else? You gave us some information on resources, which I appreciate, and we will be putting that up on the screen for people so they have websites and phone numbers and all. But anything else you wanted to bring up just to give our viewers some more information about Medicare or your advice?
sure. So I would just leave you that, you know, I work for Blue Cross. I've worked for Blue Cross for 20 years. And we are out in the community and we love to do the education. So we're at local council on aging centers. We are doing presentations at hotels. We have webinars. So take advantage of the resources out there, whether it's through Blue Cross or somebody else, Shine, Medicare. We're there for you. And the process doesn't have to be as challenging as people think. We're here to simplify it, and it's just starting with those basics, getting the basic education, and then hopefully once you find a plan, you'll be happy with that plan. I know there's a lot of choices, and sometimes choices can be overwhelming, but most people, once they go onto our Medicare plan, they're very happy with the plans that they have. So that's the good news.
Yeah, it's excellent. And I think there's a lot of choices because there's a lot of different situations, right? And so trying to remember that those choices are a good thing as opposed to overwhelming, because you're going to find the plan that works best for you.
Yep.
That's great. That's great. Well, Susan, I really appreciate your joining us. So yes, I'd like to thank Susan Flanagan from Blue Cross Blue Shield of Massachusetts for being here today. And I'm sure that information is going to be very helpful to our seniors in town and anyone assisting their senior parents or relatives, neighbors in helping navigate those Medicare waters. Again, if our viewers need advice or resources, the numbers and websites for more info will appear on a screen. And thanks again for joining us.
Thank you so much. I appreciate it. Have a great day. Thank you.
Take good care.